Hello, everyone. My name is Dr. Gavin Colquitt, and I'm the Executive Director of the Appalachian Institute for Health and Wellness. Welcome and thank you for joining me for the AppWell Annual Report. Today, I will share our progress and milestones for 2024-2025 at the Appalachian Institute for Health and Wellness, also known as AppWell. Here's our roadmap for today. I will cover our mission, a year at a glance overview, our service area, an overview of our programs, a highlight reel of accomplishments, and donors who made this work possible. You can learn more at any time at appwell.appstate.edu. Our mission at AppWell within the Beaver College of Health Sciences is to promote multidisciplinary research opportunities, clinical services, community outreach, and training programs related to holistic health and well-being with the overarching goal of improving lives through transformative social, environmental, and healthcare advances. AppWell serves Appalachian State University sites in Boone and Hickory. In Boone, we operate at University Hall and the Leon Levine Hall of Health Sciences, where we offer diverse programs and services to enhance health and well-being. In Hickory, our new AppWell location expands access to multidisciplinary healthcare and wellness services for the local community. In 2024-2025, almost 7,300 people were served through our clinics, education, and wellness programs. This resulted in over 37,000 touchpoints for service and program delivery. Our team secured 16 grants, totaling over $3.4 million. 104 donors contributed to almost $250,000 in philanthropic gifts. This gives us a total of more than $3.7 million in combined grants and giving this year. AppWell advances health through three major program areas: aging well, growing well, and employee wellness. And we deliver this impact through student training, outreach, and research. In the next sections, I will walk through program results across aging well, growing well, and employee wellness, highlighting our reach, outcomes, and momentum for the year. Aging well includes clinical services and wellness assessments, specialty programs, and educational series and support groups that help older adults live better, longer, healthier lives. Aging well experienced significant participant growth, with total program contacts increasing from 1,300 to over 1,700 this year. Nutrition programming participation grew by 40% as we expanded medical nutrition therapy across the high country. We revised our aging well assessments to improve efficiency and enable deeper patient discussions. We expanded our aging academy with thriving monthly sessions in both Boone and Hickory. Our second annual aging conference attracted 200 participants covering mobility, mind, medication, and what matters most. Finally, we hosted 23 student workers supervised by 7 clinical and professional staff as they built skills in customer service, communication, leadership, and team-based care. Aging Well offered 8 support groups for caregivers and individuals with age-related conditions, reaching 642 attendees. Following Hurricane Helene, we provided essential community and educational resources during recovery. Despite significant damage to our local senior centers, our Tai Chi and Matter of Balance classes resumed quickly and relocated to alternative community spaces, ensuring continued access and helping prevent isolation among older adults. One participant shared, "Tai Chi for arthritis and fall prevention has improved my confidence, flexibility, strength, and outlook on life." Growing Well encompasses clinical services, health education programs, community programs, and support groups for children, families, and caregivers. Parent to Parent was successfully integrated into outreach and education and provided direct support to 439 families. Girls on the Run of the High Country engaged 599 community members through races and programs totaling over 5,800 touchpoints. Camp Girls on the Run hosted 108 campers, building confidence, friendship, and physical activity skills. The PATH program, which stands for Professions and Access to Health Careers, reached 168 public school students, inspiring health career exploration. The Healthy Heart Collaborative impacted more than 350 community members through blood drives and CPR training. We launched the first community-based multidisciplinary complex care clinic for children ages 0 to 5 in the United States with a built-in high-risk infant follow-up program. We assembled a comprehensive medical team, including a physician, physical therapist, occupational therapist, speech-language pathologist, social worker, and parent-to-parent family navigators. This year, we conducted 12 clinic operating days, served 16 patients across 22 visits with an average patient age of 26.8 months. We achieved a 100% diagnosis rate for autism spectrum disorder, and 12 of 16 patients received a diagnosis for a disability or chronic condition. Employee Wellness offers counseling services, preventative screenings, fitness and exercise, and personalized and safety services for university personnel. Health promotion for faculty and staff serve 40% of all App State employees, continuing a steady 5-year growth trend. HPFS engaged over 1,500 individuals through 20,000 plus touchpoints across preventative screenings, exercise programming, and outreach. HPFS hosted 35 outreach events and saw a 300% increase in employee participation through presentations, educational clinics, campus events, blood drives, and CPR skills checks. Programming emphasized identifying wellness barriers and empowering employees with education, goal setting, and practical tools for sustainable behavior change. Counseling for faculty and staff supported 311 individuals across 2,460 interactions, providing immediate and long-term mental health care. CFS aided university recovery efforts by volunteering at the Red Cross shelter and offering sustained emotional support through the Disaster Relief Hub. CFS led 8 workshops on compassion, fatigue, and satisfaction, and delivered resilience building skills to 50 plus participants at the UNC Behavioral Health Convening. CFS and HPFS jointly presented personal wellness and trauma-informed care strategies to over 70 participants in statewide forums. CFS also delivered over 50 EMDR sessions and introduced decompression techniques, including brain breaks and rapid resets. Next, I want to acknowledge the donors and grant partners whose support fuels AppWell's mission and expands our impact. This year, we advanced 2 significant initiatives. Innovative Approaches 2.0 will strengthen emergency preparedness for families of children with special health care needs and will support their transition from pediatric to adult care. The High Country Mental Health Initiative for older adults will expand mental health screening, education, and access in rural communities. In total, AppWell secured 16 grants totaling over $3.4 million. We also achieved record-breaking fundraising with 104 donors contributing approximately $250,000 in support of AppWell initiatives, the highest total to date. We extend our deepest thanks to our platinum donors: Blue Cross Blue Shield of North Carolina Medicare Division, High Country United Way, the Health Foundation, and Via Health. Thank you to our gold donors, including Amorum, David and Donna Brown, Gail and Dan Settle, Kentura, and the Women's Fund of the Blue Ridge. We are grateful to our yellow donors, including Dr. Allie Funk, Bruce Kitchell, and the other organizations represented here for their generous support. AppWell's work is possible because of a broad network of community partners. This slide recognizes partners ranging from local businesses and nonprofits to individual supporters who strengthen our programs and extend our reach. Here is the next group of community partners. We appreciate every contribution, their time, expertise, and resources that all helps us serve the High Country and beyond. And here's the final group of community partners. Thank you all for standing with AppWell to improve health and well-being across our region. Your support does make a difference, and a lasting one. It enables community programs that provide free or low-cost services for older adults and children with disabilities. It expands access to healthcare through no-cost or sliding fee scale clinics. It advances research initiatives tailored to the Appalachian region. It fuels educational outreach through workshops and seminars, and it empowers program development and training, including staff development and student internships. If you would like to support this work, You can make a gift online or scan the QR code on this slide to donate now. Thank you for helping AppWell continue to serve and innovate. On behalf of AppWell, thank you for your time, your partnership, and your support. Thank you, and live well.